All right, we are live. Dave Kittle and the great Jerry Durham. Jerry, thank you so much for coming on with us this morning.
Thanks for inviting me, the great Jerry Durham.
Yeah. So, Dave, I was doing, and this was such an amazing experience. This would be a great way to actually start today's episode because Jerry's here. We're going to talk about patient expectations. We're talking about the patient care experience, everything that Jerry lives, breathes, does every single day. But talking about that, now, I don't think I mentioned it to you guys. I went on a bourbon tour. It's a new brewery. Yeah. I was messaging Jerry the whole time. It's a new brewery around here. It was started by a local guy. This is Northern Kentucky, right on the river. Local guy had the biggest party store in Kentucky. You hear these stories all the time. Biggest party store in Kentucky, wanted to start getting into bourbon, couldn't sell the bourbon in his store and own the brewery because of local law. So I think he sold the store, but then opened the brewery on the property. Turns out they have like an amazing aquifer below the property. So they were sourcing water on site. They were sourcing grains from Kentucky locally. This was really cool. And I was thinking about this. He didn't want to bring on a bourbon, I'm going to say chemist, because he didn't want the same Kentucky bourbon that everybody else was doing. So he got a guy from Sam Adams to come over. The Sam Adams guy actually lived in the area. He didn't realize it. He got him to come over. He was his main chemist. They do all open air fermentation. It was amazing. You go to the different spots through the brewery, you taste the different kinds of bourbon and all these things. I couldn't believe how much I enjoyed it. And then of course we went to a German, I don't even know what it was, restaurant. We listened to some German polka and music, and we just had an amazing night.
Sounds like a perfect day.
It was incredible. The only thing we were missing was baseball hadn't started yet. Now baseball is in full swing. I'm talking to two big baseball guys. So let's get the conversation going. So Jerry, go ahead, Dave.
So really quick, speaking about baseball, we got the Phillies with a winning record. I wish I could say the same for Jerry's SF Giants. With that being said, Jerry, about, I don't know, somewhere around 25 to 50% of his social media posts have him with a fitted hat. I wanted to make sure he was comfortable here at home. This is going to mess up the hair a little bit, but if you're listening, I'm putting my...
if you're Jerry, there is no such thing. That's
wow.
awesome, dude. God, dude, that was one of my favorite posts last week. If anybody saw Dave in the next era shop, I painted out everything except for his hat and the SF Giants hats. And that was fun. Hey, Anthony.
Yes, sir.
And by the way, the Dodgers lost again. So Dodgers, since going to 10 wins, are like 1-5. So I'm okay this morning. Plus my Giants won last night. Dodgers lost, so we're good. And I think Phillies won last night? Seriously.
I haven't checked about last night.
Yeah, dude. Wait, what was it? They might not. Yeah, they'll play. It was Tuesday. So, all right. Or Monday. All right. Enough of that. I think it was, what was the name of that place? Was it New Riff?
Yeah, New Riff.
Yeah. Well, and so needless to say, I'm in some bourbon, I don't want to say groups, but my algorithm pulls that up. And I just want to go on the record saying I've seen nothing and heard nothing except for great things about the product. So I just want to throw that in there. And I saw your pictures and I loved it. You know what I love most about that story? Didn't want to bring in the chemist so that it would be like everybody else's.
Exactly.
Let's face it. So I grew up in Napa, right? Napa Valley, wine. The wine part of it, it's really interesting. You go downtown Napa, there's tasting rooms everywhere. And right, so you don't even have to drive. You used to drive through Napa. It's called Napa Valley. You used to drive through Napa to get to all the wineries. Now, permitting, everything, there are so many. It's like downtown Louisville now. There's so many tasting rooms. But here's the deal, back to your point, Tony, is all these tasting rooms looks nice and they have wine in the window and it's a great setup and it's open air, but you're like, you could walk past 10 of them and you're like, right? How is any of them different? So I choose none of them, right? I'll tell you the most popular spot in town. Fuck, I got to look it up. Oh, I already cussed. I got to look it up. The most popular spot in town is the place that is run by women, set up for women, and is very accommodating to bachelorette parties, to buses, where everybody else turns their nose up a little bit. But you go, I've even been into this place and I haven't been into the other ones. I got to look it up. It's called Bubbly something in Napa, or Bubble something. It's all over Instagram. And again, it's the experience, and they sell stuff inside, right, that people that are looking for an experience would want to buy. And they're selling good product. Mind you, it's it's champagne, it's other things, but they have good product. So they nailed that. That's the interesting thing. We can tie this into PT, and Anthony, you share this stuff all the time. You can have a good product, but when everybody claims to have a good product and everybody's products looks the same, what's going to differentiate you? It's the freaking pink neon selfie wall in the Bubbly place, right? And I've posted pictures from there. I've taken a picture in front of the neon sign. So this differentiation and going forward, and again, you probably had at least 2 or 3 posts this week, Anthony. This differentiation is huge, and you can't differentiate on quality, right? You can't differentiate. I would argue you can't even differentiate on care delivery much anymore, but that's for another day. You've got to look for this experience, and that experience is all emotional, by the way, and I'll leave it at that. Right? Yeah. Everything you talked about, you didn't talk about the product. You talked about your experience there. So, yeah.
Yeah. I remember starting my practice. One of the first, I used to listen to audiobooks on cassette tape. I found a cassette tape in an old car cassette player, but one of my first books was Differentiate or Die. That was the first time I was introduced to the idea of unique value proposition, unique selling proposition. So Dave, obviously you've kind of gone more that route, the concierge route. Like when somebody says, what is unique about what you guys do? How do you differentiate yourself? What's your go-to elevator pitch for that?
I try to say something around communication, the unique ability for our therapists to come in and potentially schedule them like the next day, the same week.
How about you go to their house, Dave? That's the first thing I think of.
There's a lot of therapists that do that in New York
City.
Oh,
are they doing that now more?
In terms of like the speed to evaluation, but also like I'm trying to get out of it. I'm still doing a lot of the callbacks. And I'll tell you what, like I'm not the greatest, but I kind of wish I wish I could post some of these calls. Like some of them, listen, and I get rejected, and I can tolerate rejection probably more than most therapists in terms of like, no, that why would I pay $250 or $350 or whatever out of pocket per visit? Like that's insane or whatever. Like like some people get offended. There's a lot of therapists that I don't think can even tolerate that type of rejection. And then on the opposite end, when we have people call in and they're like, yeah, of course, or like, oh, I didn't know that existed or whatever. It's a different conversation. I really wish I could post some of these, and maybe as I should take some of Jerry's advice with like actually recording these front end conversations, and then maybe getting the patient's consent to later.
Well, you can edit. You know what I've done, by the way? I've edited out any reference to any. So I've used some calls. I don't post them on social media, but I use them for training. By the way, you can edit out names and everything, and so only the voice would be identified, but nothing else in it.
No, training, of course. I'm saying I wish I could post the call on social media.
Oh, yeah.
Pending that, obviously, like the patient would have to approve it, but to hear how myself or someone on my team and a patient actually communicates on the front end for and listen, we're not for everyone. Some people are looking to use their insurance, they're in network, and they would never fathom to pay more than $100 or more out of pocket per visit, even for a home visit. But then the people in the middle, like, of course, there's other people on the other side of the spectrum in New York City where it's like, oh yeah, like no big deal. Like, of course, that's fine. But there's people in the middle, those calls are so interesting. But it's my tonality, it's my confidence of the years of doing it. It's taking someone through, like asking them the open-ended questions, a lot of the Jerry Durham stuff, the patient experience stuff on the front end to like actually make sure like, hey, are we going to be the right fit for you? But also, are you going to be the right fit for us?
I think a great thing that you could start doing right now is, and I've done this, I've seen this, you record your side of the conversation. And even though you're not sharing what the patient on the other side is saying, I think there's tremendous value in just seeing your response, your reaction, how you answer those questions. And if you need to add context, you know, going back in post-production, you could edit it and say, now the patient said this, or this was the objection, or this is what they said, and here's my response. Because I just can't imagine anybody who's like, you're crazy if you think I'm going to pay $250, then saying, yeah, of course, share my conversation all over social media.
Right. No, it's the people in the middle that are kind of like on the fence, or they're like, oh, let me think about it. And then I'll say, oh, okay. So like, you think you need 2 days or 2 weeks to think about it? You know, most people say 2 days, and then we talk about a follow-up plan or whatever. So it's just, it's really something I maybe will talk to Jerry Durham, you know, offline to see like how I want the public and our colleagues to hear the patient side of the call, even though it's sensitive and they would have to approve it and all that. So I don't know, maybe we can get there, maybe not.
I want to go back to something Anthony said real quick, just for anybody watching this. Before I could record calls, I sat next to my front desk people, right, Anthony?
Yep.
And I was like, oh, well, I'll just listen, right? And I didn't think there'd be much value. And back to what you just said, there was huge value, because this is cool. That person sitting next to me was accountable, because I would take some notes during the call and I would know the result of the call. And so I would go back to my notes, Anthony, and go, so, you know, so-and-so, tell me at this point, you said this, what did you hear that led you to ask this question? And so there was huge value. I didn't think there was going to be any value, but just anybody listening, I would highly recommend sitting next to someone answering the phone, doing reschedules, doing new patient calls. Yeah, there's huge value to that.
Jerry, I want you to talk about the secret shopper stuff that you do. Dave, I know you have something to bring up. But Jerry, I also want you to go back. It's been so long that you've been doing this that I don't think a lot of the newer people new to you even know that you were in San Francisco, that you had a cash base, out of network practice, like all the stuff that you did. So could you take people back through your professional development so that they know where you're coming from?
Yeah. So I think this is my 32nd year in the profession. I say in healthcare, but as a physical therapist. For context, I had hair. I had a full head of hair when I started. I got into physical therapy. I worked a lot of different settings. I enjoyed them all, except for I didn't get along with my bosses, and which is a common theme. And I love sharing this story because Dave's met Karen. Dave has conversed with Karen. My wife was the one that kindly pointed out to me, after being very patient and watching me jump job to job. My wife Karen was the one who pointed out that, Jerry, there's only one constant in all these jobs. And I'll never forget this conversation. And I looked back at her going, what is it? And she goes, you. And I was like, there was a lot of dead air after that. And I went, oh. And I didn't fight her on it. It was right. Your gut is, you're right. Now, what does that mean? And my wife's actually the one that nudged me. She literally in that conversation said, you should probably consider starting your own business. And I said, there's no way possible. I'm starting my own business. And so fast forward, I did.
How did you make that switch? How did you make that decision? If you went from no way possible to doing it,
I'll tell you,
what made that
decision
decision?
Different than anybody right now. I found a space. I had some referral sources. I set up a good, here we go. You know, it baffles me. We call it a practice in healthcare. And I'm like, when is it not when are you not practicing anymore, right? When have you actually done some? But I created a practice. I didn't create a business. I didn't create a business till I was probably 8 years in. And that was when I went out at network. So I was contracted. But I knew my numbers. I will give myself credit on the front end. I knew my revenue per visit, and I knew my cost per visit. So I was making business decisions, right? I partnered up with Sturdy. We were about 5, 6 years in, 7 years in, and we knew our numbers, and it was time to go out of network when out of network was the worst 4-letter word you could use on a phone call, right? Tell someone, hey, everybody want to know, blah, blah, blah. And by the way, when I went out at network, copays were $0 to $40. So we went out, and I knew we had to change the incoming phone conversation. And I only knew it for one reason. It has very little to do with what I'm doing today, but I knew we had to have a different conversation, because if people go, do you take my insurance or are you in network? I knew I had to say no. So I was like, how am I going to overcome that? I hired 2 different people to answer our phone, salespeople, who were good at what they did, but they ended up quitting. One quit, one we fired. And I finally owned after the second one. I had no idea how I was supposed to manage it. I had no idea of the systems and processes to manage these calls. So I had set them up for failure. I literally had. And so that's when I sat down. And for most of the people I want to understand, I sat down, and this is how Dave Kittle and I met, which is cool. I sat down and I answered all the incoming calls into my 3-clinic business for a full year and managed all the new patients, managed a boatload of schedules and reschedules. And I did it poorly at the beginning, but the company depended on it, right? It was the viability of our company, and it was the fucking survivability of our company.
Now hold that thought. Hold that thought right there.
And that's how I got here today.
Okay. You said at least 3 things that are golden nuggets right there. 1, you hired salespeople to answer your phones. I've said this forever. Like, the therapist is the worst person to make the sale. Therapists are convinced they're the best because when they're talking to people, they're like, oh, I get conversions at 100%. Well, you're getting conversions of people that would have converted anyway. You're not converting people. They're coming ready to buy, ready to work with you. I think a therapist or a practice, air quotes, hiring salespeople to answer the phones, to make outreach, to do that stuff is an amazing idea. I wish even one person, I don't know a single practice owner who's doing it. If you're doing it, let me know. Bo's here. Bo might be doing it. He is progressive. You said you spent a year answering the phone. I think, and I realized this early on, answering the phone is the most important part of the entire process. And you and I agree on this forever. That first point of contact is where we need to build the rapport, the relationship, start to kind of get to know that person. And if you have somebody who answers the phone with a nasty attitude, who woke up on the wrong side of the bed, who isn't a genuinely happy person, you just destroy the therapist's chance of having a positive outcome. That front desk, that phone answering person has to be on point right from the beginning. It sets the tone for everything. You've said that forever. I agree with you 100%. And then you said a third thing. I don't even know, but Dave, what are your thoughts?
I can't recall the third thing. It might have been. So Jerry,
I hope it was ownership that I had fucked it up and that I needed.
Yeah, exactly. You were willing to accept the responsibility for the fact that you set people up for failure. I've said this 100 times as well. I thought, and I'm sure people listening, you're like, well, I'm going to hire somebody to answer the phone because I'm too busy treating patients, but I don't have time to train them. I don't have time to bring them into the culture. I don't have time to really support them and what they need to do. So you hire that person. They can't do the job that you expect them to do, even though you never told them what you expect. They fail. And now you, the therapist / owner, say, oh, I can't find any good people. It's not that
I could own beachfront property in multiple companies if I had $1 for every time I heard what you just said, Anthony. Oh, my front desk. I can't keep from. I love getting into those conversations. Oh, we have too high of a turnover. Everybody wants too much. Oh my God, they want this, they want that. And I'm like, do you have a system in place?
Right. Right. Bo said, I currently answer all my own calls. I'm always expecting it to be Jerry. Jerry did a secret shopper call for my practice. It was awesome. I had no idea. He even popped in, Jerry and Paul popped in to visit me in Cincinnati. It was amazing. It was one of the highlights of my 23-year career. But Bo, awesome. Thanks for the comment.
That was a great week, and that was good stuff. Yeah, I do secret callers. And you know what's funny? This is the other thing. So take everything Anthony just said about the front desk. Everybody says, Jerry, I want you to do a secret caller and I want you to be a difficult patient. And I'm like, hold up. How many difficult calls do you get in a week? Oh, maybe 20%. I'm like, do you maybe want to master the 80% before we work in the 20%? And by the way, if I secret call, you'll know, because this is the start. Hi, my name is one of those guys. I have low back pain. I want to get scheduled for physical therapy. And I'm going to tell you, the majority of clinics fuck that call up. And so if you're worried about the difficult patients and you can't manage that call properly, I'm like, there's nowhere to go from there. So I love doing it. And I got a notebook down here. All it is my secret callers. And when someone asks me to secret call, I just flip it over. I write the clinic name, I write the date, the time, and then I note every single question in the order it's asked of me. And then I just review it. And I do the same thing at the end of the call. So the first thing I do when I hang up is the first note I make after I hang up is, why will I arrive? And if I go back through that and there's no reason, differentiation again, other than you got my diagnosis, you got my name, you scheduled me with a PT for an hour on the day I asked for, I'm like, that's 99.999% of the companies out there. So tell me why I should arrive. And that's always the question I go back with. Because then I won't do a secret caller without debriefing. You know, I probably have done some where people didn't follow up on me, but I did them with the context of, we're going to debrief on this call. And I have someone I just did one with. And you know what? I got an email back 2 months later. Hey, Jerry, I took your feedback. I did the team. Here's the results. I'm like, you know, it was like, high five, man. Great taking action. And her business is doing better. Go on, Dave. I'll stop.
So speaking about secret callers, Jerry, in regards to how we met, sometimes the secret caller gets a secret caller.
And what happened, Dave?
No. I want you to tell the story. So
I'm sitting at my double desk, right? So all the calls were funneled through me, right, into the business. And by the way, this
is like 2014.
Yeah. So all the calls are funneled through me. And so we had one number, and I recommend this, by the way, for people looking for a front-end solution. We had one number you dialed to get, and it wasn't central scheduling. Everything that was client-facing, so doctor-facing, public-facing, everything only had one phone number. Because if you were new, then that was the number you were going to dial. And we had a process. Yes, every office had their own phone number, but just bear with me. There was only one number to go through. So if the phone rang, 75% of the time, I was the one that picked it up. I pick it up. San Francisco Sport and Spine Physical Therapy. This is Jerry. How may I help you? It was like, oh, you do answer the phone. It was like, this is Dave Kittle. And I was like, yeah, well, who do you think was going to answer the phone? He goes, I kind of thought you were talking shit and someone else was going to answer the phone. I'm like, no, I answer the new patient here. So it was great. That's how I met Dave Kittle.
So that was Tony. That was the first time Jerry and I had ever spoken. I was on Twitter around 2014, and there was this, there was this guy, Jerry Durham, this Twitter account, just baseball stuff, bourbon stuff. We talked about, SF Giants, sometimes very professional, sometimes a little inflammatory, but just super unique, very interesting. And he was posting, all these tweets and tweeting and things like hashtag director of first impression and hashtag patient experience and all this other stuff. And it was like, he was super interesting. He was engaging with like experienced therapists, but then like new grad therapists. And, I was at the time, I graduated in 2011. So I was only like 3 years out of school. So I was on there to do some networking, learn from some other colleagues and all that. And I didn't know Jerry at all, like literally other than Twitter. So it was like without a voice, without any call or anything. And I was like, I don't know, like this guy's got multiple locations and he's on Twitter's, like 90,000 tweets or whatever. Like how is this guy answering the phone if he's like on Twitter all the time? So I wanted to kind of call him out. And so then I called.
Yeah. Dave only did it out of the goodness in his heart. Right.
Yeah. And so, but yeah, to my surprise, he answered like on the, first or second ring. And then he goes, yeah, Dave Kittle from Twitter. I remember, blah, blah, blah. He goes, let me, this is the main business line. so let me call you back on your cell or whatever, and let me open up the business line. And then, you know, we talked from there. I sent him a letter. It was
Give me a great letter. I still have it.
It was a handwritten letter, and basically like my takeaways, my learnings, my thanks for his time on the phone. And I actually still have, like, when I do calls with people like Tony and Jerry and all these other, I just found, because we did a bunch of moving of boxes and stuff, I have handwritten notes from calls with you guys from like 2015, 2016, 2017. It's pretty wild.
That's amazing. I always think about that. I'm like, I think about how my messaging has changed since I first got on. Facebook was the first social media platform I got on. There's Jerry's notes. Ben Fung was one of the first guys that I connected with. I started in his group, and then just building those connections and those relationships. I want to say it would have been around 2016, 2014, maybe. I remember creating a Twitter account. I'm not on Twitter, but I saw Jerry here. That was the first time I ever saw Jerry's name. One quick message. So for everybody who's listening, go check out the Dave Kittle Show. Go check out Jerry's podcast. Go to YouTube. Go to your favorite podcast platform. Listen, these guys are putting out tons of free content. They need your support. Go find them. Go support them. Subscribe. Listen. Okay, so that being said, let's hand out a little bit of practical advice. Jerry said something really important. Why, if he was a patient, why am I going to show up for that first patient visit? Why am I going to show up for that interaction? What we do now, truth be told, we don't do it anymore. We're so mature as a company. We're so old. Most of the people that we're seeing have been coming to us for therapy for a decade or more. But what we used to do was, right from that initial telephone contact, the first time we spoke to a human, we booked the appointment instantly, and then we initiated the evaluation right then and there. So, Jerry, you're got some back pain. Tell me what's been going on. Who have you seen? What have you tried? What makes it better? What makes it worse? Have you ever had any surgery? We literally, and it could be my administrative person, it could be my PTA, it could be the clinician, it could be anyone in the organization, because this is not a billable event, but we can start the admission process. That person can pull all that data. And what it does, even if it's just 5 to 10 minutes, it puts an investment into that patient so that they feel like, I've already connected with this group. I'm already part of this family. I'm ready to come in here. They know me. They've got all my information. It kind of ties them to us a little bit. The other thing that we do to ensure they're going to be there is we have a metric. We want every new patient in the clinic for an evaluation within 24 hours of that first contact. Unless there's a surgical reason they can't be there, if you call my clinic before noon, you're coming in that afternoon. If you call my clinic afternoon, you're coming in tomorrow morning. There is no reason you should wait another longer than 24 hours to start therapy. And so those are the two things that we just push, not because we're greedy capitalists, but because we want to do what's in the best interest of the patient. And if I give that patient a week, 3 weeks before they come in, they're going to forget. Their life's going to get busy. They're going to get tied up with other things. So either one of you guys, I'll pitch it over. What's one little tip that somebody watching could say, yeah, that sounds great. I'm going to implement that tomorrow.
Jerry, what do you got?
I'll tell you what. So I just incorporated this recently, going through all this and line by line, piece by piece. I got a 5-step process. It's floating everywhere. I give it to everybody. So, it's out there. So there is a basic structure of this conversation, and it's based on listening. And the key here is the listening part. And there's some good I'm going to be honest. There's a lot of good research behind the 5-step process, whether it's sales books, incorporated with what people want from healthcare. I started incorporating after I tell people what they'll get when they arrive, that first visit, right? Which is that, and I'm going to make a statement, so everybody apply it to your business, to that hour-long session with their expert, Dr. Jane Doe. After I pitch high level what's going to happen, and that's based on the research, I literally pause and I don't say, what questions do you have? I just incorporated this like 2 months, I'm getting better results with it. Does this sound like a solution that will, I don't want to say will work for you, because that's not the right question, right? It's what question do I want answered? I want to know if they'll commit to coming. So does that sound like a solution you want right now? And putting that question in after scheduling all of this, and by the way, being comfortable, you know me, I hate dead air, and I'll talk for fucking 8 hours straight. Going, so Anthony, does this sound like a solution you were looking for right now? Does this sound like a solution that will work for you today? And then I got to sit, because here's what I find out from the secret callers. And again, all this stuff needs context. People pitch the eval more consistently for all this stuff they don't do. People pitch the eval. It's so fast, it's so unpurposeful that it goes straight over the person's head. And I'm like, that was the product. That was the pitch. So be purposeful with selling the hour with their expert, and then go, Dave, does that sound like a solution that will work for you today? And then sit in the silence, because Dave's got to process what he just heard. So there's my 50 cents worth.
And that question, Jerry, would you say that that's like a pre-close? Like you're
You're right, dude. Yes, you are 100% correct. Because by the way, in my system, guess where we go next, Dave? Price. We go price next. Yeah, 100%. So does that sound like a solution to you, Anthony? Right? And basically there's two we all know. And I hear this by the way, I listen to calls too, insanely. I love listening to calls. And I get, so Anthony, does that sound like a solution to you? Absolutely. And I'm like, we're done here, right? Cool. So Anthony, the only thing left is let's talk about how you want to pay for this. Versus, and I hear people let this go all day long. By the way, when I listen to calls, I tell people, do not tell me the result of the call. I don't want to know how it ended, right? Because then it biases me. So I'll listen to this and people go, so they'll pitch the eval and what questions you have, or does it sound like a solution to you? Yeah, well, I guess so. And then they go, great. And I'm like, no, not great, not great.
Because they show up 50% of the time. If they're saying that, they're going to
an opportunity to meet this uncertainty head on. Because I'm like, their risk of not showing up just went through the roof. Yeah. So every part of it. So ask that question. Hey, Anthony, does it? Because solution is expectations, and expectations correlate with outcomes. So if I ask that question, I'm asking Anthony, does this meet your expectations of what you were looking for?
Yeah.
Now, what's challenging about this dynamic is when you get busier and more confident as a therapist, as you're building a practice, the tonality and the confidence comes through on a lot of these calls, or maybe your admin after you train them over the first year or two or whatever, the confidence, the tonality comes through. You're more likely at this point to slow down the process where you want to hear from them. Like Jerry just said, you want to hear like a heck yes or a hell yes, or absolutely, something very confidently, a confident response. When you're in your first 1 or 2 or 3 years in a practice, especially if you're cash or out of network or whatever, you're more likely to gloss over if they're like, yeah, like Jerry asks, so does that sound like a solution for you? How does this sound? Like, you want to get some feedback from them. And if they're just like, yeah, like, I guess so. If they're like that, your first 1 or 2 or 3 years in practice, you're more likely to be like, all right, so like Thursday, 9:30 a.m., I'll see you then. And like, and then half the time they show up, right? Because you glossed over.
Right, and that's the result to measure. You're right, Dave. Am I managing these calls properly? How did it end? And did the next step? Because this call is a step in scheduling is a step in the process. It's not the outcome. And you ask 99% of the front desk people out there, what is your responsibility? They'll say to get people scheduled. And I'm like, holy shit, scheduling doesn't pay the bills. I love asking owners, when's the last time a scheduled patient paid you?
So let's take this conversation a step deeper. Jerry has talked about cancellations and no-shows. I have a feeling, but I want to hear it from the horse's mouth. I have a feeling it's one of those things like they always say, when's the best time to plant a tree 20 years ago? When's the second best time now? Jerry, what is your advice? How do you handle cancellations, no-shows? Do you prevent them from the start by getting buy-in from the patient? Do you give them a reason to show? What's your thought?
That's a softball question for Jerry. Here we go.
So the answer is yes, Anthony. You nailed it all. Cancels are, I'm just going to say this. Cancels are complex only in the sense of, right, when can I manage them? When can I prevent them? Then that gets you to take that step back. So I'm going to share, right? I've been doing this 30 years. We just had a call last night with someone, and I'm like, everything I told them not to do, I go, by the way, I did that for 10 years. So please, everybody listening to this, I answered the phones for a year, and I did it for a year because the first 3 months were so shitty. I had nowhere to go. I mean, I had to keep doing it because I had no info. Yeah. By the way, someone keeps asking about cancels. My last 5 LinkedIn lives are about this. I don't know where you can find. I have the recordings. If you want to message me on LinkedIn, I'll tag you in every post. But I've talked about cancels, cancel fees, managing cancels, preventing fees the last 5 weeks in a row on LinkedIn, and the video should be there. But DM me and I'll tag you in all of those. I'm happy to do it. Cancels can be prevented, and I've proven it over and over, can be prevented by managing the new patient call differently. That's it. And it'll never go to zero. That was the other thing. By the way, it took me like 15 years to own this. I'm like, why am I striving for zero? It can't be. So that was step number 1, right? Was just owning the fact. And then budgeting in. I recommend all my clients, I make them budget in empty slots for the year. And Tony, where you live, you got to budget, right? If you don't budget the weather, right? If you're where you are, you've got to budget the weather. And I'm like, you can't be, a cancel is about priorities. You cannot be, and by the way, even your wife, even your spouse, even your significant other, you can't be the number 1 priority 24/7, 365. And we have to own that too, right?
Right.
Yet we got to build that priority. We got to earn that trust. We got to earn that alliance. We got to earn all of that. And it starts, and this has been the theme, Anthony, you've been saying it. It starts on the first phone call. Dave knows it. I mean, Dave and I go back and forth about what you do downstream, but I'll tell you what, we align very much so on what needs to happen on the first phone call. And if you change that first phone call, right? I chased my therapist for 10 years. Yelled at him, right? Constantly. What are you doing about your cancels? Went upstream and watched cancels drop by 50% of my business. I went, oh, I fucked that up too. Wow, I fucked a lot of things up.
Dave,
so
what about you?
It's got to start upstream. It's got to.
So over on my show, Jerry and I debated the cancel and no show.
That was a great call, dude. That was a great call.
You know, there's every practice is different, right? I think maybe with outpatient, like you have fixed costs and your therapists are just there already, and whether they're independent contractors or 1099 or W-2, whatever. For us, like we're paying our therapist per visit, and our therapists get paid. We charge the full rate for a late cancel no show. We're pretty like we don't really waive it. Like people, like we over communicate about it on the front end.
See, that's it. So even if you're going to collect it, over communicating on the front end. And you're managing and setting expectations. That's the key here. That's the answer, Anthony, to your question. Sorry, Dave, because it's not different for us. It's really not.
But when we were debating this, I was saying that we're charging the full rate. So like right now, it's 9 a.m. on the East Coast, right? If a therapist has a patient today at 5 p.m., we're going to charge that patient the full dollar amount out of pocket. We have every patient credit card, debit card on file. That therapist will get paid that full dollar amount, but they're not going to go to that person's apartment building because they already canceled, right? So that therapist can maybe go home an hour early. They can go sit in a Starbucks for an hour. They're going to be compensated. I did that because I was with another practice years ago. I showed up to a couple different residences over a couple years. And the patient was not available. They went out to grocery shop. They forgot about whatever. They did an errand. They weren't home. The housekeeper's like, oh yeah, they walked outside. They're outside, or I don't know where they're at. And so when I was with that practice, going to these homes in New York City, these apartment buildings and all that, I literally showed up several times, didn't get compensated for those visits. And I said, when I implemented this with my practice, I put myself back as the treating therapist. And I said, I want to show value and I want to show that I respect my therapist and their time and all that. And so my therapists get paid. No other practice does this that I've ever heard. Like Fox definitely doesn't do it. And a lot of the in-network insurance practices that are doing home visits don't do this. So I want to do it as a differentiator. Now, I told Jerry when we debated this, we had one patient that tried us for 1 or 2 visits. And they were like, yeah, I don't like this 24-hour cancellation policy. And they stopped seeing us. One person in, 5 years.
Yeah.
And I don't know, like we have a significantly low cancellation rate. Then Jerry said, well, Dave, knowing you and your practice and your setup and everything, Jerry thinks it's more about like my overall patient experience and all that as to why we have a low cancellation rate and not because of the cancellation fee.
See, that's the other thing. Thank you, David, for bringing that up. If I get in another goddamn Facebook group that says my cancel rate went down after we charged full price, I'm like, I got questions. I got some questions. And I did this, and thanks, Dave, and I'm going to jump in here because I have a client who has 4 offices in upstate New York, right? All in network. When I started working with them, they had a cancel policy and a fee. Cool. We didn't touch it. We didn't change that process. But they did the fucking work. I just told them what to do. We increased their volume year over year by 30% with no more new patients, AKA less cancels, less no-shows, less drop-offs. We didn't change your cancel policy. And so, right, we changed the experience people were having, and we're doubling back to the beginning, Anthony. We changed the experience. I want to give myself a little credit. I'm gonna pat myself on the back here. I've got a research paper coming out, an opinion paper with 3 other people. My name's on the end. I was like, you can leave my name off. I don't care. My name's on the end of this paper with 3 people whose research I read to put together the work I do today. And we put together an opinion paper, and it's going to be published in a research journal saying the whole team, AKA the experience, has an impact on patient outcomes. And here's why you need to start considering more than just the providers. And I'm like, this is right. This is my proof of process. This is the proof. And so that paper hopefully will be published pretty quickly. And needless to say, I'm going to just get that thing tattooed on my chest. And when everybody goes, I'm going to go, here it is. Here's the proof. You got to do this work, man. So, yeah.
Jimmy always says research takes 17 years to get published. I hope it's quicker than that for you.
Yeah. Well, here's the other thing. I got a whole shelf of sales books up here. The oldest one from like 1940. And I guarantee you that book from 1940 outlines exactly what we're talking about today. Yeah. So the sales research has always been there, Anthony. I tell people you've just been looking for the wrong research, right?
Humans don't change. Humans are humans. I love pulling a thread through these episodes, and I'm going to go back to the very beginning, my story where I said New Riff Bourbon, they went to Sam Adams to poach one of their chemists, do things differently if you don't want to get the same results, right? Definition of insanity. So you look at Dave. Dave was like, I didn't get paid for these sessions when I was doing it. I never want to do that again. I'm going to do things differently. You were in network. You went out of network. You've developed new ways to do things. You do things differently. Baseball. We started the episode talking about baseball. Have you guys watched the Savannah Bananas?
Dude.
Yes.
It's amazing.
The founder, mark my word, the way that Vince McMahon is basically a billionaire from.
Yes.
He will in 20 years be a billionaire because of Savannah Bananas.
It is incredible. My kids love it. I can't wait to get tickets. We went, Harlem Globetrotters came to Middletown. They played in a local high school gym. It was a beautiful gym, but that was a great trip. Once I get a chance to take my boys, we'll go watch Savannah Bananas and we'll love it. Doing things differently. So yes, the pre-framing what to expect is going to have a major impact. Yes, the conversation from first point of contact is going to have a major impact. But the culture of the patients you attract, there's a certain community of people that recognizes the value of what Dave is delivering and understand in order for them to get that value, they have to pay in advance. They have to have a responsibility. I think one of the most detrimental things to the conventional healthcare model is the fact that so many of our amazing Medicare beneficiaries don't pay anything out of pocket. I understand they pay monthly premiums. I understand there's huge expense, but if they're not putting money, if it's not painfully expensive, they're just not going to value the service they receive. Now, I'm in that world. I am in that world. My patient demographic is not Dave's demographic. It's not Jerry's demographic. I am treating the people who will come to therapy if it's not costing them more out of pocket, who will do it if they're not busy getting the comb out or doing something else. And I'm okay with that because I want to be able to still deliver affordable care to that patient demographic, to that population. And so I can't handle necessarily my cancellations with cancellations fees because I'll lose the entire episode of care. You guys aren't saying that, but I'm just saying. So for me, what I did was I said, okay, what are my tools? What are my resources? How can I do things differently? I've got 2,000 square feet. If a patient shows up, it's not going to affect me because we have kind of a pub style treatment. I know everybody poo-poos too many people in the clinic. I love too many people in the clinic. On Fridays is my main day to treat. You'll see any Friday, it's just me. I don't even have an admin most Fridays. And there'll be 5 or 6 people. There'll be husbands and wives. There'll be, neighbors. We're talking, we're socializing. Some are doing physical therapy with me, billable service. Some are doing exercises on their own. Some are non-covered maintenance. We just have a bunch of people in there having a great time, getting healthy, and that's the environment. That's the culture I want. So what I did was I said, okay, how can I eliminate breakage? Because that's what it is, right? There's shoplifting for retail. There's breakage for manufacturing. How can I eliminate the negative impact of breakage? I will have special slots where if somebody shows, awesome. If they don't show, that's okay. I look at who's in the clinic right now. Who am I going to provide billable service for? Who am I just going to let work on their home exercise program under general supervision, which is not billable? And it works for me. Now, it doesn't work for for other therapists that have been on my team, so I don't make them do it. I only allow the therapist to enjoy that kind of environment. I enjoy it. My 2 PTAs right now, they're the kind of people that enjoy it. We like the social engagement, but I know it's not for everybody. But that was a way for us to eliminate cancellation fees, to have a fluid schedule, to work people around where it's going to work best for them, work best for us, and deliver service without barriers. So if you got something else you need to do, no problem. Go do it. Come in later. Come in tomorrow. Just come in. We still schedule, but we can be flexible.
So I want to pile on to that.
Yeah.
Because it's perfect. It's a perfect segue here. I am payer agnostic. I am model agnostic, right? So I go in with my clients. I just need to think for a second because I want to make sure I'm saying this properly. I've never told anybody change your model. I've never told anybody to blow the whole thing up. What I do with my clients, and I know this sounds like a pitch, everybody, and if you think it is, then it is, because I got to talk about this because this is where I find people are successful. As long as I go in and get a good feel for the current state. What are you currently doing? Here's the kicker: to serve your community. That's what you just outlined, Anthony. Dave knows his community. You know your community, and you both have created models that feed and work for you in your community. That is the key here. And so when I work with clients, that's the first thing I do. Who are you serving? And by the way, most of them cannot answer that question like you and Dave just did. And then I say, if you don't know who you're serving, we all know this, then you serve no one, then you can't please. If you're trying to please everyone, you won't please anyone. So I'm going to say, because I've worked with practices who take Medicaid, and I love that challenge because man, you want to see us fucking project out and blame everybody else? Holy crap. And I'm like, Are you set up to do this? Do you understand? So that's the other thing, Anthony. Do you understand the person that's calling you? Do you understand their expectations, their important issues? I use this example all the time, and I'll stop here. You get a call into your office, and you have pelvic health, and it's a woman telling you she just had a baby, she had a C-section, it's been 6 weeks, she wants to get started with physical therapy. Cool. You ask nothing else, her doctor name, everything else, right? And you schedule her at 7:30. Now, parallel universe, you get the same call from someone you schedule at 7:30. One of those is a single mom with 2 kids, right? Already, now her 3rd kid, doesn't have family support in the area, right? The other one has family support, is married, the husband's working, they have home care. I'm like, you got to learn about those 2 people upstream and figure out if you can serve them. I continue that story on for other people, because one of those people is going to drop off, and it's going to be the single mom, and the PT is going to go, well, I knew it, and I'm like, no, you weren't ready for it. And probably they shouldn't have been scheduled with you. Right. So both of you understand your community. Both of you have set up businesses to facilitate success. By the way, this is all fucking business. This has nothing to do with healthcare. You both have set up systems to facilitate a successful client journey. That's it, man.
I want to talk about.
I love the fact you brought that up, and I love the fact you both shared. Now I'll be quiet.
No, it's true. Now we've got a couple minutes left. I want you guys to think about the parting shot. But one of the things you said, you mentioned Medicaid, and I want to share a little story about, our 23 years in practice now. So I own a building here in Middletown, Ohio. We had 2 spine surgeons that were renting space from us. They saw a huge population of individuals with persistent problems, multiple complexities on Medicaid insurance. These are individuals that didn't have transportation, so they had to schedule transportation. Locally, it's called UTS. I don't know what it stands for, but basically, they might arrive an hour early. They might not show up. They have to schedule these appointments 48 hours ahead of time to let UTS know they need to get picked up and come. I'm sure in urban areas, there's public transportation issues as well. And so exactly what Jerry said, we had to make the decision, are we able to treat this population? Can we accommodate their limitations? Now, I don't do pediatric. If somebody refers me a pediatric patient, I refer it out. I don't do neuro. Somebody refers me neuro, I refer it out. This is really no different. It's just a different way to categorize. But yes, I acknowledge that I had the capability, I had the resources, I had the location, I had everything needed. I just had to figure out, how can I create a system to serve this demographic? And what we did, now let's go old school for a second. We have our schedule, we have color coding. So a green is a new patient, a yellow is a follow-up, purple is a progress report. If I knew that I had a referral and I did the evaluation, but I knew that there were transportation questions, I knew that it wasn't guaranteed this person was going to show up, I was able to create a system where I would, quote, ghost them on my schedule. If they came, they got a treatment. If they didn't come, they didn't get a treatment. Now, I know practices that can't do that. They don't have the resources. They can't do that. So what they do is they say, you get a 3 strikes and you're out. If you can't make it, you schedule 3 appointments, we're kicking you out. I didn't want to do that. I wanted to do things differently, and so we were able to build a community and a culture where even if that person who was ghosted on the schedule showed up and I had another patient scheduled at that time, the other patient was so bought into our culture and wanted to be part of it. They didn't care if we had 2 or 3 people there. They were fine if that was a non-billable treatment for that other person, because I'm going to focus the billable time on the person who can't always come. And it was just amazing. I mean, like, this is the kind of environment that I love, a very fluid environment, but it has to meet your resources. It has to meet what your business can do. And it has to meet your therapist's expectations. Like Dave said, I couldn't force certain personality types to be in that model and be successful as a therapist. I can be in that model, but you can't ask me to be one-on-one in a private room with a patient either, because I will fail in that model. I will go out of my mind. So you have to understand the culture you can deliver. So guys, what are the parting shots? What do you think?
Parting shot for me, going back to the very beginning of the conversation about the different bourbon places, and Jerry talked about the one that was, so we've talked about, Jerry, we talked about the word remarkable, meaning, unique enough where you make a remark about it, you retell a story, and you told the story about the one with the pink wall, and it accommodates bachelorette parties and women, and it's different, right? So I think my parting shot would be, as I'm getting more and more on Instagram with my practice, Concierge Pain Relief account, I'm looking at what else out there is working, that's successful, to capture attention and interest on the front end, even before the phone calls that we're talking about. So how can practices be interesting, unique, get attention, whether it's simply whatever the newest, TikTok dance is or whatever, or it's other, content and media strategies, which we'll probably talk about on future episodes, whether it's, some choreographed dance in the office. It's non-clinical things. The videos could be non-clinical things. I'm thinking about, I've had ideas doing batting practice with a suit on and putting that, just stupid different things. So that's my parting shot, is how can practices do things online that are different and unique that will result in more attention and eyeballs?
Cool. I'm glad you went first, because you're talking marketing, right? And you know me, I'm going to go to sales and downstream. So I'm just going to pile on to what Dave said. So if you figure out, right, what makes you remarkable, and you're doing things exactly like Dave said, it's going to make the sales process easier. It's going to make your front desk job easier when you ask them to put people on the schedule with an increased likelihood of them arriving, paying, and staying. So my parting shot is, I set up the mirror thing. This is the last time I do this. Do what Dave just said, and it's going to make yourself, I would say the best way to make your sales process better is do better marketing. And the best way to do better marketing is to get more feedback on the first phone call, so that your sales team can give the marketing department better information on who to attract. So this synergy of marketing and sales is huge. So that's my parting shot.
I love it. My parting shot is, guys, if you're still here, you got a ridiculous amount of value. Go subscribe to Jerry, go subscribe to Dave, follow these guys, listen to their message. I realize, I've been doing some business development. We'll talk about that maybe on Thursday. It's opening my eyes, because I've stepped out of direct patient care a little bit more. And I'm like, listening to Dave, listening to Jerry, listening to these voices has penetrated so deep into my mind that I am regurgitating the things that they're saying. And I'm genuinely understanding these perspectives that I never knew when I was, working 6 days, 7 days a week as a clinician in patient care. So Bo is saying, what did he say? Jerry's podcast is dead, though. Bring it back, Jerry. Is that true? You got a podcast?
Today.
What? Today? All right.
It came back today. I can't believe you brought that up, Bo. And perfect timing. Thank you for the pitch.
Bo is the king. He's got thousands of interviews. I cannot believe the level of production.
Bo's on LinkedIn Live, and Bo, you've been having some good conversations on LinkedIn, my friend. So people may want to start peeking at your content.
Absolutely. I was the guest on Bo's
talking to different people. Yeah, man.
He does a great job. Kelly Starrett and his wife, great guests, high quality.
Yeah, the last few I've seen flow through, I'm like, wow, this is good stuff. My marketing site. So you got to talk to Dave on that.
All right. See you guys.
Thank you.
Guys, thank you.